And I'll get you tomorrow. It's 9:04. We're the link on the breeze, 93.9. Good morning on you, KUAM FM in Agotnia, Guam. Network of nurses. Really proud for this segment that we partner up with the Guam Nurses Association. Been running a few weeks, and we've been able to get some really cool stories with some really awesome, hardworking nurses out onto the show. And so this morning we're going into the Department of Corrections. We're at Agania, right?
Yes.
With corrections nurse Donna Mateo. Good morning, Donna.
Good morning, everyone. Good morning, Guam.
Good morning, Guam.
Good morning. How's everyone doing?
We're doing pretty good. Excited to hear about your story, and we'll just get right into it. So I know that you're based out of the Guam Memorial Hospital, and you were telling me that you were deployed there to the prison in 2016. Can you kind of walk us back to what was that? Just something like the boss said, "Hey, you're going to DOC," or was this something that you were interested in doing?
Oh, yeah. So GMH decided to take over the medical department here, the medical side. So the GMH nurses and physicians are the ones that take over the medical interventions here at the prison setting. And yeah, I've been here since 2016. It's something new to me, and it's actually very interesting. So my background is actually from the telemetry department. I've been working there for about 15 years before I came over here. So we have nurses here with really, really good backgrounds. We have an ER nurse with really good background in ER nursing, long-term care, and then you have me in the progressive care and an ICU nurse. So these detainees and prisoners and inmates are in really good hands when it comes to their medical care.
What do you think, or just right away when you were deployed there in 2016? What was it like? Just the differences between working in the hospital setting and working in the correction setting.
So we have this is basic. There's a hospital setting, and then you have the clinic setting, and this is more of a clinic setting, an ambulatory care clinic. The difference is that you have to. We try to find the people that actually have chronic issues, because some of them won't tell us that they are sick. We'll hear from their cellmates or what have you. So it was a huge change. Usually I came from the telemetry department, and it's usually like the is set up. We have to check their vitals and everything here. Sometimes we just have to make sure that, okay, is it really chest pain or is it anxiety? So we do an EKG here in the clinic to make sure that it's chest pain or a real heart attack, or if it's just anxiety. And if it's anxiety, then we just refer them appropriately to the psych department. Or if it's something real severe like a heart attack, then we'll refer them to the ER department so they can get further evaluated.
I know it's pretty close quarters there at your facility in Agotnia and in Manila as well, because I've been on the tour. But how has COVID-19 and all the protocols about social distancing and just everything being ramped up to avoid the spread of the virus, how's that affected your mission there as a corrections nurse?
Okay, so in the correctional setting, in all jails throughout the U.S. as well, they are very close together. They can room with somebody. They can have a cellmate of one or more people, depending on the population of the amount of people that come in. So it's hard to do social distancing here in the prison setting. So we try, really, really hard to not have the COVID virus come into the prison. So we do a lot of strict assessments so that it doesn't come in here. Because once we do have it, we're going to have a lot of people coming in, right, and it's going to spread really fast because of the close proximity. And we can only, there's only so much we can do here for social distancing. It's very difficult, but we do try our best to do it where, for example, our detainees, they get seen by a physician and get a physical exam the moment they come in and they're ordered to stay by the judge. If they're ordered to stay, we do a physical exam. In those instances, we do social distance. We make sure they're 6 feet apart, and they all wear a mask. And when they first come in, if they don't have one, the department will issue one to them. So those are measures that we try to take to prevent the spread of COVID-19 here in the prison. The areas here get cleaned frequently, and that's basically what we do here. We also do temperature checks twice a day, and we quarantine them also for 14 days before they get moved to the general population. So, those are ways that those are our challenges. We work closely with the corrections department, and so the correctional officers, the admin will determine where their isolation is going to be. So we isolate them as soon as we have any inclination of COVID. We will isolate them immediately and work from there, monitoring them.
Have you guys done any test training for testing COVID-19?
Yes. So it was in the news that we did do COVID-19 labs for our patients. We have a few nurses here that are considered swabbers. So in the event that we do decide to have our own COVID-19 swab, we have the nurse particularly that does the swabbing.
But at this point, I guess
we don't have that right now,
okay,
but it's
okay.
in the process.
Right,
Yeah.
right.
So that'll be part of our plan as well for our pandemic response plan.
You guys have been very fortunate in that, as far as we know, we haven't had any inmates, prisoners, or detainees test positive for the virus. That being said, there have been some of the COs, the correction officers, who have tested positive. When we talk about mitigation and the pandemic protocols, what do you think it is that has, kept DOC kind of in that safe spot where we want it to be, COVID-free?
Well, anybody that walks through our doors, even whether it's the nurse, the correctional officer, the attorneys, or anybody that walks through our doors, we do temperature checks, and we have an area for them to wash their hands and practice hand washing. And so we're the ones that are more likely to bring it into the prison. The employees, the ones that go home, that get exposed to the community. So corrections and medical work together to make sure that we do our best. We do social distancing with the officers as well, and with the nurses in our office, in our clinic.
Have you guys been called upon to provide any sort of assistance or guidance to the Department of Youth Affairs down the street where there have been 3 positives?
I'm sorry, can you repeat that?
Have you or any of the nurses over there at DOC been called upon for any sort of guidance or advice for what's happening down the street over at the Department of Youth Affairs where there have been 3 positive cases of COVID?
Oh, well, no, actually, we don't work with the Department of Youth Affairs, but we just get our guidance from public health.
Okay.
So that's part of our team that we work with, but no, we haven't gone to the Department of Youth Affairs. No.
Okay. I was just curious, considering the fact that, you're both kind of,
Oh yeah. Like it's both a correctional, right?
Mm-hmm. All right. Well, thank you so much for coming on.
Donna,
Thank you, Sabrina.
I know you want to give
Thank
a shout out to the staff working hard over there.
Oh, yeah. We all work so hard here at the department, with the law enforcement, the correctional officers, the nurses here. So I'm in Agana, and we have our other team at the Department of Corrections in Manilao. So yeah, we're working really hard, and they deserve a lot of credit as well. All of us, actually. But it's a teamwork. It's a community effort. And yes, we just need to work together and fight together with this virus.
How many people on your team over there at the prison?
Well, for the medical staff, we have about 3 nurses every day, which consists of an LPN. We have our physician that comes here as well to take care of all of the medical emergencies and needs that we need assistance with. So we have another physician, and we have the mental health also department teaming up with us here as well.
Okay, that's good. So there's enough virtual corned beef fried rice there behind you to take. I just wanted to make sure we had enough for the staff.
Thank you so much.
Can you give one to
everyone?
Give one to Major Anton too?
Yeah.
Okay, thank you.
All right, take
Thank
care.
you, Donna. Thank you so much for your hard work.
Yay, thanks.
We appreciate it. Okay. Esta, wash your hands. There you go. Donna Mateo, corrections nurse, part of our segment with the Guam Nurses Association, network of nurses. We're coming back with a congressional candidate forum. That is next. Here on the link, it's The Breeze, 93.9. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.